Redzone Medication Safety Initiative by Jennifer Engel, Beverly M. Small, and Ruth Brediger.
Guess what happened? She broke it.
And I say, you break it, you buy a situation.
Pretty much. And the sellers were like, that bracelet. And guess what happened? She broke it.
And I say, you break it, you buy a situation.
She's good. She had a rough night, but she's sleeping right now. No, I can leave him here. He'll be sleeping. The yard house in Winfield.
Jen, can you give me an update on your patient for report tonight?
She's doing well. We're just working on diuresing her.
I can meet you somewhere if you want.
Really nothing major going on today.
Sure.
How are parents doing?
Parents are great.
Because she didn't just faint
They're
just
super
because.
supportive.
She
Getting plenty of
had
rest
a
today.
jade mark.
8 South, this is Jen. Oh, she's doing okay. She just got an echo this morning.
No,
But overall she's doing pretty well. She's very stable. No, I don't think she's quite ready to get her chest closed yet. Okay, I will.
She
I'll
had a
call you
rough
as soon
night,
as
but
I
she's
hear
sleeping
from
right now.
And you can guess what happened? She broke it.
And I say, you break it, you
Jen,
buy a
can you
situation.
give me an update on your patient for report tonight?
Overall she's doing pretty well. She's very stable.
Yeah, I'll be
Okay.
Medication errors are a preventable cause of morbidity, mortality, and escalating healthcare costs, and therefore are a continued concern across the spectrum of healthcare. A major contributing factor to medication errors is distraction at the bedside. Distractions come from the abundance of technology at the bedside, as well as frequent interruptions during medication administration and verification. In 2008, the cardiac ICU at Boston Children's Hospital developed a nurse-led interprofessional group to create and implement a program-wide quality improvement process for medication safety. To better understand the relationship between distraction and medication administration safety, we organized a nurse-led interprofessional committee to identify factors that led to medication errors, created strategies to reduce these errors, and implemented a distraction-free practice in the cardiac ICU. The committee included nursing leadership, pharmacy personnel, and physicians. We identified 4 overriding principles with the goal of creating a distraction-free practice and decreasing medication errors. The 4 safety principles aim to empower the healthcare team involved in ordering, dispensing, and administering medications, ensure the cognitive workspace is free of distractions and interruptions, create a work environment characterized by teamwork and effective communication, educate families about the importance of a distraction-free medication process. The Redzone Committee developed several tools and strategies to support our distraction-free practice. We developed a logo indicating distraction-free areas. We created Redzone badges that included the distraction-free symbol and a common language script for nurses to use with patients and families. We placed signs and floor decals with the Redzone symbol in front of the medication Pyxis stations and medication rooms. We provided education for all staff to minimize interruptions and distractions to healthcare providers during medication administration and ordering. And posters were placed in each patient room, waiting area, and in welcome packets to inform patients and families and ask for their support. Here are some scenarios showing examples of our Redzone tools in use in our daily practice.
Good morning, family and staff. To provide a safe environment during nursing report, we're asking for distraction-free time from now until 7:30. Thank you.
Baby Boy Smith is a 3-month-old, 3-kilo patient who came in on Monday for an ASD repair with Dr. Imani. He did very well
Jen,
postoperatively.
I just need to get ready for rounds. Can you tell me how Baby Boy Smith's night was?
We're actually in the middle of Redzone for nursing report. Do you mind coming back in just a few minutes?
What's Redzone?
The Redzone allows for distraction-free time for us to exchange important patient information so we don't forget anything if we're interrupted.
Oh, okay. Sorry for interrupting. I'll come back when you're done.
Thank you so much. So as I was saying, he did very well on Monday and is now ready for the floor. Good morning.
Good morning.
My name's Jen. I'm going to be taking care of Jackson today. How are you guys?
Good.
Good. I'm just going to take a few minutes to double check some of her medication, so I'll be in the Redzone and distraction-free time, but I'll let you know as soon as I'm done to answer any questions, okay? All right, great.
Jen, did she get her Dwyer last night?
Oh, you know what? I'm just still in the middle of checking some of her medications and distraction-free time. I'm happy to answer that question as soon as I'm done, though, okay?
Thank you.
Thanks.
Jen, did she pee enough last night?
You know what? I just don't want to make any mistakes with checking her medication, so just for Jackson's safety, I need to focus on distraction-free time for just a few minutes.
Absolutely, sorry.
Thank you so much for understanding. All right, great. Looks like all of her drips look good. I'm all set with distraction-free time, so I can answer any of your questions. What were you asking about?
Did she get her Dwyer dose last night?
She did. She got her Dwyer by 8 o'clock, and she had a really good response from it.
And how much did she pee?
She was negative about 140 overall, so that's great. We're really happy with how much she's making urine.
Thank you very much.
Sure. She's doing really well overall. We're really pleased with how Jackson is recovering.
Thank you.
All right.
Hi, Jen. How are you? I'm totally dying to see you because I wanted to show you pictures from the weekend. They came out awesome.
I would love to see them, Vicki. I'm just in the middle of the Redzone right now, getting out some meds. Can I catch you a break?
Yeah, sounds good. Thanks.
Thank you so much. The Redzone Medication Safety Initiative allows the nurse safe and protected space and time to perform high-risk activities without interruptions or distractions. Distraction-free time also includes your shift report and safety checks at the beginning of your shift. You may ask for distraction-free time to focus at any time. Just remind your families and staff that you are performing an important task, and for patient safety, you need distraction-free time to focus. After the implementation of the Redzone Medication Safety Initiative, the Cardiac Intensive Care Unit saw a significant decrease in medication errors. We had about a 30% reduction in the first year and over 70% reduction in the next 4 years. Strategies to reduce distractions and interruptions at the bedside have now been adopted throughout the institution as the hospital has successfully created a culture of safety and high reliability. The Redzone Medication Safety Initiative successfully reduced medication errors by creating a distraction-free practice which utilizes various tools and strategies. Bringing awareness to the healthcare providers about distractions at the bedside was a critical step in empowering staff to adopt the Redzone strategies. We continue to assess the success of this initiative in medication safety, but have also expanded this distraction-free practice to other patient care activities to reduce risk of patient harm. Thank you for allowing me to share our experiences with the Redzone Medication Safety Initiative in the Cardiac Intensive Care Unit at Boston Children's Hospital. I hope these tools and principles will allow you to develop your own safer nursing practices.
Please help us improve the content by providing us with some feedback.